this week I had the absolute pleasure of talking with Dr. Dan Beese, who's a fellow medic and YouTuber. We talked about everything from burnout to mental health to people pleasing to addiction and so much more. And initially when we said we would have this conversation, I had the idea of breaking this video up and using snips of it in other videos, but it was such a good conversation and I think you're going to get so much from watching this. So we've decided to publish the whole thing. Yes, more than an hour and a half's worth of content, and I hope you enjoy it. Get yourself a cup of tea, and if you're not already subscribed to Dan, then head over to his channel and click subscribe to see more of his content. He's got loads of great stuff out there. I hope you enjoy the video, and let me know down in the description box below what you enjoyed most about it. And also, I've been thinking about whether or not to start a podcast, so let me know what you think about that after you've watched this video. Here we go.
Okay, well, hello, and
Hey.
hello everyone. Today I've got the pleasure of chatting to Sarah. Sarah and I were at uni together. Sarah was a graduate entry medic. I was an undergrad, so we had slightly different journeys, and maybe we'll touch upon that shortly. But since then, Sarah has also, I guess, taken the less well-trodden path, which I'm now sort of starting down, and just wanted to jump on a call and sort of go through a few things. So yeah, welcome to the channel, Sarah, and thanks for having this conversation with me.
Oh, it's absolutely my pleasure. Thank you so much, Dan. It's a real treat to get to talk to a like-minded doctor and YouTuber and person who's interested in all this stuff. So hopefully we'll have a lot of value to share today.
Yeah, fingers crossed. So yeah, I just first of all wanted to just start with, like, how has it been since university, and what have you been up to, I guess, since graduating? It's been a while now, unfortunately for us.
It has, hasn't it? We're getting old. I'm definitely getting old. So yeah, it's been a wild ride. So we graduated in 2017 and did F1, F2, which is the first 2 years after graduating as a doctor in the UK. I vlogged my whole experience doing that. So if anyone's interested in checking that out, you can have a look at my YouTube channel there. But essentially, I really enjoyed my F1 and F2, but I found it really, really hard mentally and very exhausting. I don't know if you had the same sort of experience as me, but I came out of my F2 experience feeling like a bit of a broken human. And I had the plan that I was going to take an F3 year, which is basically a gap year after your first 2 years of training. I was going to go traveling. And then in that time, my plan was to apply for A&E training, emergency medicine, because I absolutely love emergency medicine. And what actually ended up happening is I went traveling and then decided to just carry on working in the emergency department as a locum, picking and choosing my own shifts, rather than applying for training, because I could choose my own work hours and the money was good compared to what it would be in training. And I felt this freedom that I didn't have anyone telling me when I had to be at work, when I could have days off, when I could be available for friends' weddings at weekends and things like that. And I've never looked back. So that's the abbreviated version. I've done a few other bits and pieces along that journey, but that's where I'm at.
Yeah, no, I mean, I think it's, you know, more and more common, isn't it, to have like a foundation year 3 year, as people call it, where you sort of take a bit of a year out, normally locum or travel. I think ours was maybe a bit disrupted by COVID, because we'd obviously finished our F2 in about 2019, and I knew that, yeah, I certainly had more plans to travel in 2020 before COVID. But similarly, I had sort of the idea of just taking a year or two out and then going into anesthetics, and I was very much still building up my portfolio to apply. And over sort of the time period, I realized that less and less I saw myself being kind of a consultant in a sort of typical role within the NHS, and enjoyed the freedom of things like locuming. And that, I guess, got my sort of cogs whirring about what actually do I want. And I think medics are very guilty of maybe not considering that question too deeply, and maybe just putting our heads in the sand and passing exams. And that's, I guess, a kind of way of distracting or sort of avoidance, I guess. And I think a lot of people find comfort in that. But for me, especially with how the NHS has been, it was sort of very apparent that I couldn't keep going, and sort of had to, I guess, confront that. And the first step was to apply to GP, but even then I was like, I actually need to just take a break from this and figure out, is this exactly what I want? So that's sort of where I'm at and how our paths have crossed in the YouTube space.
Sorry to interrupt you there. So I was just going to ask, when you're talking about deciding to not go down the route of becoming an anesthetic consultant and sort of stepping away from that training and going into GP and then deciding that's not for you, was there a particular moment that you can remember that you decided enough's enough, or was it like a slow burn of multitude of things?
Yeah, I think it was. I think I have had burnout, essentially, and almost every time I went back to work. I remember I had a bit of time off actually in F2 during my geriatric job. I found that a really challenging job, and I then had, had some time off, went into public health, and I was fine. And then almost the next job I had was in my F3 year. That was a PICU job, and I was very sheltered. But then I guess after that, I worked in COVID, and then I worked in sort of general peds, and my resilience and my tolerance of, I guess, these things, especially after the second wave of COVID, where I worked in a respiratory ward, it was just so low. And then I sort of worked in peds, and that was a bit better, and I was able to work a bit less. That was kind of the coping strategy I guess I had. But then going back into training, I had to, because I was taking a pay cut, had to at least work 80%. And I started on acute medicine and then A&E. And I just found it wasn't overwhelming, because I had experience, and I knew what was appropriate and what I could mitigate my risk and prioritize much better because I had more experience. But emotionally, I was checking out. And there were a couple of occasions where I didn't lose my temper, but I was very short with a couple of patients in A&E in the January just gone. And it was to the point where I was like, what? Like, that's not me. And I was less patient with loved ones, and I was tired all the time. And I was just like, I actually don't enjoy this existence as a whole. It's not just affecting me at work, it's affecting me at home. And it's a shame, really, because I actually enjoyed parts of the job, but it was just becoming too much. I don't know if you can resonate with that.
100%. Yeah.
Unfortunately,
I found I got to the point, especially in F2, where I was so tired all the time from trying to fit in. I was trying to continue my. I was kind of like rebelling against the work schedule. Like I always turned up to work and everything, but I really made a point of I didn't want to give anything up. So I really made a point to go to all the social events and to do everything and try and keep my life outside of medicine intact as best as I could. But ultimately I probably wasn't resting enough, and I was so tired. Yeah. Because my schedule with work, as with every medic, didn't allow me to rest enough and to do all the things I wanted to do outside of work. And same as what you were saying, that negative energy was just spilling over into my own life. I felt ratty. Yeah. There was a particular, I remember asking for I've spoken about this before online, but I remember asking for a friend's wedding off on a Saturday. For work, and they gave it to me. They technically gave me the day off, but I'd finished nights the night before, so I went straight from a night shift to one of my best friend's weddings. Yeah, and I remember just being so tired there that I barely have any memories of the actual wedding itself. But I do remember going into a toilet and crying because I was so exhausted, and that's not normal. It's not okay.
And the medic in me is like immediately the thought is, oh well, at least they gave you technically the day off, but it's like, no,
Yeah.
like that's your best friend's wedding, I think you just get used to, and the culture is that, we're people pleasers. I think, if you were to put us in a group, and that collectively as a group means that you're very easy to, well, I imagine there are difficult doctors to manage, but I don't think, we're as compliant, or I think we're more compliant than maybe another workforce, and very considerate, and almost the sort of like patient safety or the care of our patients is used as a sort of carrot or weapon against us, I guess. And we just then get used to putting up with, fairly, well, just stuff that we shouldn't. And that's the prime example. Like the first thing I thought was, oh, at least you were there. And it's like, no, like, and it's like retraining yourself. Like I wouldn't treat someone like that. Like, why, I don't treat my patients like that. So why am I being treated like that? It's challenging, but yeah, sorry, that's not what you want at your best friend's wedding, is it?
No, it wasn't good. And that's just an example. I mean, there's so many other examples of similar to what you're saying, that I just felt so tired. I felt so ratty. And I feel that I think I was burnt out at the end of my F2 year. And I think that in retrospect, I didn't realize how tired and how affected I was by that burnout. And I think it took me the best part of a year to actually feel normal again.
Yeah.
And I only realized that in retrospect. And I wondered what your experience of that is, if you feel that you've come out of the other side of burnout, or are you still recovering, or how are you doing?
Yeah, I think so. I go through waves of like, at one point I'm like, oh, burnout is a term that's overused, and maybe I wasn't ever burnt out. And I guess that's maybe part of the like medical culture as well, of sort of just neglecting yourself. But then at the same time, I'm like, no, I was burnt out. And for me, we worked hard on things, but my PICU job in my F3 year was really well supported, and we had good resources. We were well staffed, and the care that we gave was excellent. So that almost like was a bit of a buffer for me. I felt refreshed and reinvigorated with a bit of hope, and sort of buffed up from that point of view. And then going into the second wave of COVID, I worked at Woolwich in a respiratory ward, and the team was great. I cannot fault the consultants or the nurses, but we obviously became overran. And I was there for maybe 5 months, and that was extremely difficult. And we didn't really have registrars because they were covering the nights. The consultants would do a week on. So I think, to be honest, and maybe I am biased in this, but I don't think, it was me and a couple of other SHOs that were working with a group of F1s and F2s, and you end up taking on quite a lot of responsibility. So we were there, every day, and taking on, the difficult phone calls or the difficult conversations with families. And obviously the consultants were leading the care and the decision making, but you actually picked up a lot of the slack. And that was definitely the job that I found the most challenging. And, we did have some group sort of discussions afterwards with like the Macmillan nurses, and that was helpful, just to realize that actually I was probably slightly traumatized. But, up until only very recently have I stopped. Like, it's weird. I would just visualize the ward. I'd just go in my mind down the ward and just like check that I knew the ward. For some reason, the ward was like, the map of the ward was something that I just would play over and over. And there were individual patients as well that sort of like, or individual moments. There was one chap that was on CPAP, and I was working with an excellent nurse, and honestly, I did not have, a great, it wasn't looking great for this chap, but the nurse was brilliant, kept the mask on, kept him comfortable, and we managed to get him through. And for some reason, I just every so often just like think about him. And obviously that's a positive story, but I think that in itself is the fact that you go through these moments. I'm sure, other professions have that, but I hadn't had that before, like the patients and the ward of that job. And and I think you need a lot of time off, to be honest. I think you need a proper good time away to actually, to decompress, because almost every time you step in an A&E, you're in the same kind of environment. The same hormones go through your body. It's the same stress hormones that are motivating you to get through the next few patients, and actually that can bring back difficult memories and just puts you straight back in that place. And I think that explains in my head why I've mentioned that I feel like my resilience to these things is just less, and that kind of makes sense to me. I don't know if we probably need to speak to someone. So we've had a couple of technical issues, but we're back. And I was just asking Sarah about your current situation with medicine. I know that it's, you haven't, I don't think, ever applied to training and have been locum in A&E, but I just wondered what your current thinking around that and the future, and, what your thoughts were.
Yeah. So I've got a mixed relationship with medicine at the moment, in that on one hand, I really do love working in A&E. I love the fact that every day is different. I love the fact that it's quite fast paced. It's exciting. I learn something new every shift. And the team that I work with is absolutely fantastic. It's a really supportive environment. And in that sense, I think I'm very lucky to get to work there. And I also think it works well for me because you see your patients and you make a connection with them, and you help them in that scenario. But then the next day, doesn't matter how traumatic one day is, the next day is completely different, and you don't have to, in some sense, deal with the same patients that you did yesterday. So every day is a fresh start. I really like that about A&E. However, I think COVID has made working in A&E a really stressful and quite traumatic experience. And I'm finding myself coming home from more shifts saying I didn't enjoy that than enjoying it. So I'm finding work quite stressful and tiring at the moment, and I'm more tired than usual. So I think I'm in a phase where I'm craving more work that's not medical. So I've got my YouTube channel, I've got an online course, I do aesthetics outside of medicine, and I'm really focusing on those at the moment, and kind of just doing 1 or 2 shifts a week in the emergency department. So I feel like I've got a good balance, and I feel very lucky that I'm able to have that balance and that freedom. And I'm aware that if I were to step up to full time and do 4 or 5 shifts a week, that I would not survive in that environment for very long, quite frankly.
No, I mean, I can definitely resonate with that. But you've touched on a few things that I actually do want to come back to there. But I have noticed, in myself that, and maybe in a classic career, this naturally happens. You have less, patient contact, or you're doing less of the sort of admin, or, and maybe, you're making more decisions, but you're further away from that, and maybe that protects you. But I have noticed that, throughout our time at university and seeing on your socials that you've had an Etsy store in the past. I don't know if you've still got that going, and you've always had this entrepreneurial streak in you. And I just wanted to pick your brains as to where that may have come from, or if that's something you recognize in yourself, or just understand a bit more about that aspect.
Oh, thank you for asking that. I don't know if it's necessarily entrepreneurial. I think one of my core values is freedom, and I love the idea of making money on my own and not being tied to a particular income source. And in med school, so as you touched upon earlier, I did the graduate entry course, and I was funding my own way through it. I got a little bit of loans. It wasn't enough to cover my monthly expenses. And so at med school, I had a part-time job which was working as a healthcare assistant. So I was med school in the week, HCA at the weekends. I was so tired, and I was like, something's got to give.
Oh, how did you do that?
And lots of people in my year did that kind of thing, because you know, got a lot of, like, we had single mums, we had a lot of other people who had, there was a guy who had a full-blown business that he was running on the side, like a proper business. So a lot of very busy people on our course, and I got to the point where I was like, can't keep doing this, can't go to the hospital 7 days a week, I need a break. And I was like, how on earth can I make some money outside of actually, you know, giving my time for money? So I decided to, I'm quite artistic, I suppose, creative, and I decided to start doing these little watercolor paintings. And I was like painting stuff, making prints, selling them online, and hit a bit of a jackpot in that people love their pets, and I started doing commissioned pet portraits. And that made me more money than doing my HCA work, my healthcare assistant work. So I carried that on for quite a long time. Now I sell, my sister and I design stuff, and we have it printed onto things, and we've made enough products that we literally just package and send them. It's no effort, but it's just a little bit of extra income on the side. But so that was what I did basically through necessity at med school, just trying to think of what I could do that was different. And then after med school, I think I started doing aesthetics in F3 or F4, I can't quite remember, but I saw some friends had Botox, and I was like, you look great. Why do you look so great? And they told me, and I was like, oh my gosh, I need to learn how to do that. So decided to learn how to do aesthetics, and I now have a little clinic in the front of our house, actually.
Sticking with that topic, I just wanted to talk to you about aesthetic medicine. Obviously, it's something that is, you know, increasing massively, and just wanted, you know, obviously you said that the reason why you got into it was because you saw, I guess, the end result and thought that it was actually, you know, something you'd like to be able to deliver, I guess, to your patients and learn more about. But how did you end up then going about, you know, finding out how to become an aesthetic doctor? And can any doctor do that, or can any nurse do that, or what's the sort of breakdown of that?
Yeah, so any doctor can do it post F1, and nurse prescribers can do it, and nurse pharmacist prescribers as well. And it's actually quite an unregulated industry, unfortunately. There's a lot of pressure to try and make it more regulated, so hopefully it will become a safer environment for patients, because there are a lot of people that are doing it that aren't actually qualified, like beauticians and people who, I don't know how they're getting their hands on Botox, because it is a prescription drug. And doing fillers can be quite dangerous. Well, there are a lot of risks involved with doing fillers if you don't understand the anatomy. But that is a conversation for another day, because I could rant on about that for ages. But yeah, how did I get into it? So I actually came across a dermatology consultant when, it's a very convoluted story, but I'll give you the short version. It must have been when I was in my F3 and I was applying to a locum agency. The lady that interviewed me for this locum agency was a doctor herself, and it turns out she was a consultant dermatologist. And I was like, why are you interviewing me for a locum agency? You're doing this admin role. And she was like, well, I'm from South Africa, and I'm waiting for my equivalent licenses to come through from South Africa to be able to work as a consultant here in the UK. So I'm just doing some admin work in the meantime. And I was like, wow. And so we ended up going for a coffee, and she was very kind to let me pick her brains and ask her all about aesthetics, because she does that in South Africa. And she was basically like, do it. It's amazing. You get really good results for patients. It's a wonderful area of medicine to work in. Go for it. So she really encouraged me and gave me some ideas and advice about the kind of courses that you need to be a safe practitioner. And I went from there and did a course down in London, the advanced training course. And then since then I've done some other courses to kind of upskill a bit. But yeah, if anyone's interested in getting getting into aesthetic medicine, I would say go for it. If it's something that you feel passionate about, then it's a great industry to be in. But you do have to have a bit of a business mind about you, because no one's going to find clients for you. You have to do that yourself.
Mm. And so, just on that course aspect, is there like you mentioned it's slightly less regulated, but is there a sort of standard course that you have to do, or and then is there any, do you have increased indemnity, or is there companies that look after that? Or because I think that is the thing that I imagine stops a lot of people from like inquiring a bit more, is just the unknown of what that framework looks like.
Yeah, sure. And that stopped me for a while, and I was really grateful to be able to have this chat with this dermatologist about it. There is a course, there's like a very minimum basic course that you have to do, where you've got like a load of pre-reading to do, and you go and do some practical skills as a basic thing. And then there are further courses that you can do to go on to do like the non-surgical rhinoplasty and those kind of things. I don't offer those sort of treatments, but yes, there is a standard basic course to do. And in terms of indemnity, you do have to have extra cover. Your cover that you have just working as a doctor in the hospital will not cover you for private aesthetic work. So I pay, I think it's about £600 a year to be covered to do the treatments that I do. And then it's just about, similar to other areas of medicine, it's about keeping your knowledge up, going to conferences, networking, keeping your knowledge and skills up. But it's a really interesting area to be in, because working in private practice is so different from working in the NHS, because you obviously set your own hours and that kind of thing. But you also have to think about, like I've mentioned, finding your own patients. So you're having to deal with all the marketing, business side of things, and talking with your patients before their appointment, doing the follow-up, and then dealing with the admin side of things, how you schedule your appointments, where are you going to base your clinic, how much is a good amount, are you being scammed for how much you're paying in rent, that kind of thing, and ordering all your supplies, buying the prescription drugs, making sure you've got all the emergency kit. There's loads to think about, and I just kind of figured it out as I went along. So it was cool. It's hard, but it's paid off and it's fun.
No, that's really cool. And what I'll do is I'll speak to Sarah afterwards, and we'll link the course down below, and maybe some essential links that may be helpful we can put down below as well.
Sure.
But then, so you sort of started that, and then you've recently had a bit of a break from YouTube and have been working on, I guess, your next, not venture, but I guess it's like a passion project from reading between the lines. And I just wanted to introduce that and maybe get a bit of how that came about as well.
Thank you. Yeah, I appreciate you bringing that up as well. So I took a break from social media. My break from social media was only meant to be like a month or two, and I ended up taking off a year. And I kind of regret it in a way, because I feel like I've lost a bit of momentum with YouTube and Instagram. And Dan and I had a bit of a conversation before we jumped on this call, where we were talking about imposter syndrome. And I feel like I'm in that at the moment. I'm kind of like, I'm getting back into YouTube, and where do I fit in this space now? And you have all these feelings about, have other people gone ahead without me, that kind of thing, which is all just mental drama that's going on that I'm just making up in my own head. And I just need to like focus on getting valuable content out to my audience. But the reason I had a break from YouTube was to be able, twofold really. I had a lot of stuff going on in my personal life. My stepdad is very ill, he's terminally ill, so I wanted to take a bit of a break to focus on family and to be able to be there for my loved ones. And the other reason is because I've made an online course, which is the passion project that I think you alluded to. Essentially, I had this idea of making an online course, probably similar to how you did with your YouTube channel, that you've like had this idea for a while, and you know that it's something you want to do, but you just haven't quite pushed yourself to go ahead and do it. And like, I knew when I wanted to do it, I wanted to do it well. So I kind of put it off for a long time, the perfectionist in me coming out. And I knew that I had this YouTube audience, and I wanted to be able to, I kept finding that I was getting the same questions from people again and again, and comments, DMs, emails, people asking me about, one of my most popular videos is me talking about failing my final OSCE, and people commenting on that about, how do I get my confidence back? I feel like I'm failing in life, lots and lots of questions about self-esteem. And then the other kind of question that I get asked a lot about is, what do I do with my life? There are so many people out there who feel like they're stuck, they're in a rut, they are just going through the motions of each day. I'm sure we've all been in that scenario, and just really wanting some guidance about what the hell to do next. And so I did this survey where I asked my audience if they'd answer this detailed survey anonymously, expecting I might get like 10 or 15 responses from people, because it was quite a long ass form. And I got 200 people writing to me, telling me their like innermost fears, the things they were struggling with the most. And almost universally, the two things that people wanted help with was more self-esteem, what to do with their life. And so I was like, that's the course I'm going to make. So I spent a year researching and creating this course, and it's out there now, and it's seeming to hit the nail on the head. I'm hoping the people that have done it so far have had really good results, and I'm hoping that it will reach more people and that they will get the same sort of impact from it. So that's where I'm at with that.
That sounds great. And I mean, I think, I'm sure your audience is, I guess, medically orientated or interested, I imagine, to a degree. I think that's, perfectionism and imposter syndrome are traits that we see in medics and, healthcare workers and carers quite a lot. So I can definitely resonate with a lot of what you said. What was it around your finals? Was that the sort of experience that you drew upon when, because I've had a look at the course, it's like massive, and like clearly a lot of work has gone into that, and that motivation to perform or execute something, that thorough must have come from, I guess, somewhere more than, I want to, create a course to sell. It's it's very clear that there is a much more, that's why I call it a passion project. There's a deeper meaning, and that where does that come from? Is that from the finals, or?
Well, thank you for the kind comments about that. I think it is partly from the finals, because that failure impacted me hugely. That was a big hurdle for me to overcome. And I think that we all go through phases in life where we like hit this stumbling block, whether it's, failing an exam or losing a job, losing a loved one, losing a partner, whatever it is. We all go through the same things in life, failure, and go through those same emotions. And I felt like I made life a lot harder for myself through bad coping mechanisms, which were perfectionism, people pleasing, and procrastination. And I was like, I need to get myself out of this rut. How can I do that? And then using the tools that I used on myself, I kind of developed them into a bit of a system and did a lot more reading and research into those, and kind of like actually looked at what is the evidence base behind these things, and not just like, I've had this idea, this is worked for me, like anecdotally, okay, there's a bit of that, but a lot of it is evidence based.
That is fascinating. And those things that you found helpful yourself, I guess you found were backed in the literature. Is that
I suppose I took a really long windy route in getting myself out of those sort of ruts. I'm going through perfectionism and people pleasing over and over, and failures over and over, and burnout. I've been through many rounds of burnout, I think.
Yeah.
And maybe I did it a bit backwards in that I found what worked for me and then thought there's got to be a better way. I can't keep going. Maybe I'm not probably wording this very well, but I got myself out of those situations and then thought there's got to be a better way. What's the evidence? And then looked at that evidence and kind of systematized that into a process that people can use to not have to take the windy, many years route that I did.
Yeah, of course. Try to streamline that, I guess. And
that would be a quick way of answering that question.
No, I mean, I guess, you always like, I think you need both, don't you? It's like you can't be a great doctor just knowing the books. Like you have to have seen, hundreds, thousands of patients and put the two together. And, you wouldn't, it wouldn't be a great course, I imagine, without the long, windy, painful perfectionism, route that you took. And I guess that probably complements one another. I think that reflects in your channel. You govern an audience, and clearly, I think part of that is how authentic and sort of natural your channel is. And
thank you.
I'm sure that's the same in the course.
Well, I think that my channel is natural and authentic, which is very kind of you to say, because I just didn't have a clue what I was doing when I started and had no idea what I even wanted from my YouTube channel. I didn't really have a direction, and I was just filming on my phone, picking my phone up and going, "Hi guys, welcome back to my channel," and talking about anything and everything. I had no real clear direction. But what I find really impressive is that you seem to have this, you seem to have that direction and that focus. And what I love about what the videos that you've put out, and that I don't think there is enough of on the internet and in medicine, is that your videos are so, you're not afraid to, including in this video, you're not afraid to tell the truth and be open about your own struggles and your own failures. And that opens the conversation up for other people. That video where you talked about your own position in life and your career, just reading through the comments below that is really powerful. There's so many people that are saying, "Oh, this is a breath of fresh air. I didn't know I felt like this, but this is how I feel." And especially, I think for I don't know if you feel this way, but I get the sense that a lot of men aren't having the discussion about mental health openly, and are using humor or brushing things aside as a bit of a coping strategy. And I felt like watching your channel is a breath of fresh air, because you're able to so eloquently put across what you're feeling and make it okay for other people to feel that way as well. So thank you for opening that line of conversation for people. And I think you're doing some really important work. And I'm very excited to see where your channel goes, because I think you're just going to be skyrocketing in the very near future.
We'll see. Thank you. That's very kind. I do. I agree with you in, especially around men. I think, and this is me speaking as, a non-professional now, just my opinion as an individual. I think almost we have started that, breaking down the stigma, and almost people are aware of mental illness and mental health, but actually just talking about it and having, wellness days or whatever, and then having a conversation one-on-one with someone, those are very two different things. And I still don't think we're quite doing that enough. It's not that it's from a bad place. I think, people do genuinely care and are increasing understanding. But I think, and men are definitely guilty of that. For me, I think the very, example that I've had personal experience with and that I see so commonly is, gambling problems, and that is not covered. It's starting to gain a bit of traction. I follow, I'm in a bit of a strange position with the doctor thing, and so I don't. Maybe I'll end up going into it a bit more, but I follow charities. There's one called Gambling with Lives, which do some really good work, and they're starting to get sponsorships of, you know, betting off football shirts and things like that. But it is quite insidious how the industry does prey on quite vulnerable people. And actually, you know, you would never offer free cigarettes to new customers in a corner shop, which is what a free bet is. Or you would never offer a free pint on your 18th to, you know, at Wetherspoons. Like, that would be frowned upon. And actually that is industry standard in that industry. And I think, I think it's a shame. I think, you know, I look back and I feel very lucky. I had a very good GP at the time who had not himself personal experience, but like a close family relative. And he said, if you don't go to Gamblers Anonymous next week, I will take you on Sunday.
Wow.
And I just cried. And
that's incredible.
And that motivated me to go. And it hasn't been plain sailing since then. But that definitely, I think, is a space that I hope will be improving. I think the tide is starting to turn. Maybe people are starting to realize how big a insidious issue. And the thing is, it's so silent. It's like mental health. You know, you hear these horrible stories of, you know, people not realizing how much people are suffering, and gambling is so easy to hide. And so we'll see. I think it's also easier to say in hindsight. It's so much more easy to say, oh, I've struggled with depression in the past. But actually, I remember when I was ill, and it's very difficult to then say I am struggling. And so I'm definitely looking back with that awareness. But thank you for the kind words, though, because it's something that I definitely care about. And hopefully that will be something that this channel can explore. I'm not sure about the comments of knowing where I'm going, but yeah, I mean, how long have you been on YouTube?
Oh, ages and ages. My channel has had such slow growth. It's unbelievable. Slow and steady. I think I can't remember if I was still a med student or not when I started filming videos. I was when I say I was filming about anything and everything, I did I think one of my first videos was a hairstyle video. I mean, I don't know what I was doing, what I was thinking, but anyway, I've been on here a very long time and the growth is slow, but that's okay.
And how have you found that? I don't know. I think being a medic, there's this sort of I always have this anxiety of oh, what if I say the wrong thing? Or, I don't, even then I was caveating with this is my personal opinion. How do you find that as a YouTuber? And, do you find that a challenge, or?
As in balancing professional opinion versus medical opinion?
Yeah, and just having a life outside of medicine and that being okay and you not being perfect. And, I think maybe there is a paranoia around extra scrutiny from the GMC than there actually is. But, we are regulated, and that is always at the forefront of my mind every time I press upload. Yeah, for
sure. And I think there's a good reason for that. And, the GMC have to protect have to protect patients and have to uphold the honor of being a doctor, or however they word it. But terrified. I used to be so scared that everything I'd put out would be under scrutiny. And I did get an email from HR at one point, a very strictly worded email from HR, where I was like, oh my God, I'm going to shut down my channel. Oh my God, I'm going to delete all my videos. And then I sat on it for a couple of days and realized, no, they're not actually telling me I've done anything wrong, which I hadn't. They just wanted to make sure that I was complying. So I emailed back everything from the GMC guidance about social media and how it applied to my channel. And then they emailed back saying everything was fine and it was all okay. So that was kind of my my experience with that. But I think there's a balance between the actual concern about professionalism from the GMC standpoint versus what is actually just perfectionism and your mind telling you like it has to be exactly right or else, and what that or else is, and essentially what we're doing is a good thing. I really strongly believe that putting ourselves out there on social media and showing what our lives really are like is a service to other people. And I don't know about you, but when I was like 17, 18, or in my early 20s, like being able to watch someone going through their actual career and the highs and lows and seeing their daily life and seeing, oh yeah, they have a normal life and they've, you know, they go on normal walks, they're going and doing their food shopping and worrying about the same things as I am, would have made me feel so much better. And that's what I wanted to create with my channel. And that I think you're doing with yours as well.
No, absolutely. And I think, I think, you know, this is what I've learned as well with moving away from medicine and coming into the space is, you know, if you can make such a difference to so many more people. And, you know, I really enjoy teaching, do try and, you know, be approachable. And I can remember hating going onto the ward as a med student, and just I empathize still very much with those medics. And but actually I can only, you know, do that for like 2 patients, you know, every couple of days when they come on the ward. And almost this is like a, you know, I do a bit on TikTok with some medical education stuff, but like you say, like even encouraging people into the profession and giving an honest account of it, you know, I think that's important. And, you know, especially with the strikes on at the moment, you know, it's very easy to, well, the media around that is a challenge, but to navigate. And actually at 16, I didn't read the news, but, you know, I'm very willing to say that there are parts of the job that I absolutely love and still do. And I'm having a bit of a break at the moment, but, you know, at the same time, there's challenges and almost, maybe you're right that actually that would be a useful thing for a potential applicant, or, you know, someone thinking about it. So yeah, but I've never had that thought about, oh, it's a good thing, you know, which is my head telling me that, you know, you know, telling me lies, I guess.
It's funny, isn't it?
Yeah.
What you're saying there about being able to impact so many more people by being online is like basically exactly why I wanted to do the online course, because I don't know about you, but one of my favorite parts of work, as in medicine, is the human connection. And that probably sounds really cheesy, and that's the kind of thing that you'd say in a medical school interview, but like genuinely, my favorite bits of work are when I've gone in and explained something really well to a patient that they may not have understood before, and they come out saying, you know, oh, thank you so much, I really understand my condition now. Or making a cup of tea for a patient that's been sitting waiting for 6 hours, and then having a chat with them, listening to someone tell you about their grandchildren and about their previous career and their garden. And that human connection for me is the best part of the job. You can take it or leave it with procedures and, you know, fancy diagnosis and all the other stuff. Very interesting. Love anatomy, love physiology, but the human connection is the one thing that I adore and that I don't want to lose ever. And I think that moving, even if I completely move away from medicine eventually and have my income source as an online thing, making money through YouTube and the course and everything, maybe doing some in-person stuff, my hope is that I'll still be able to have an impact and connection with people, and maybe more people than I would be able to on a one-to-one basis in an A&E department.
No, I agree. And, you know, especially with the fact that it doesn't have to be a medical question or complaint. You know, it may be that you actually just show someone or walk them around to the scanner and I don't know, ask a few questions or listen to them about, you know, something that may seem very trivial to you, but clearly is, you know, massive for them, and reassurance. And I definitely can massively, resonate with that. And that is, you know, that is the allure of the job, I guess.
I'm focusing a lot at the moment about the things that keep popping up in the world of the people that I'm talking with online, through YouTube and Instagram. And my newsletter is 3 main character traits that keep showing up, which is people pleasing, perfectionism, and procrastination. And I am very, very, very I know those traits very well, because I'm trying to recover from all of those things. I like to call myself a recovering perfectionist and people pleaser and procrastinator.
Yeah.
And those are kind of my default coping mechanisms whenever I come to a stressful situation. And I wondered if those kind of things, firstly, if those kind of things affect you. It sounds like maybe slightly with some of the things we've talked about in this conversation. And secondly, do you think, if they do affect you, do you think that those are things that you had before you started medicine, or are they things that have kind of come upon you since going through med school and becoming a doctor?
The answer to your first point of the question is yes, definitely. And avoidance, perfectionism, and people pleasing. And I can definitely relate to all 3 of those. I guess, being honest, I've actually got better at definitely 2 of them. And almost it hasn't been a linear journey. So I certainly think when I first came to university, I was very disorganized. Avoidance was just like out of control. And I remember going to see a counsellor in my first year, and just my life was chaotic. I was drinking far too much, and avoidance was just like fueling that. And this counsellor, I remember just, you know, I'd never had any counselling or anything before. It was completely new to me. And she just like looked at me, and for about 3 minutes, she could just tell me everything about my life. And I was like, what is going on? This lady who I've just met, it just like, she knows me. And it was just incredible to, you know, and now I look back and I'm like, she's an experienced clinician, and, you know, certain traits or pathologies present in a certain way, and and obviously I was just like the classic avoidance kind of, I guess, and everything that came with that. But I remember she sort of put me on that was when I first heard the term avoidance. And I had some CBT therapy in my 4th year, and that has massively helped, I guess. But I was sort of aware of it from my first year in that interaction. And that is definitely, I think, better. I think the thing I struggle with the most still is perfectionism. And I haven't really got a massive handle on that. And I still think I am a people pleaser, and actually leaving medicine, half of the battle, probably more than half of the battle, was what will people think, and how does this make me look? You know, it's not even like what will certain person think, it's like how will my image be to people that I haven't even met yet, you know?
Yeah.
What will it say about me to say that I left or I couldn't continue in the NHS? What does that say about me? And so that is definitely still a thing. I think my tolerance for conflict, which I struggled with a lot, has got better, and I am more willing to voice concerns or disagree, which I couldn't do. I was a yes only guy. And I think similarly, I think, you know, it was probably CBT that helped with that. But ever since my 4th year, when I was quite unwell and sort of started to have an idea of things like, you know, your mental health and understand it more, these are things that I think the practices that I have sort of developed and found an interest in and continued to try and work on, they're kind of, you know, all of these things are symptoms, I think, of a problem that I am sort of working towards as it is. And as a result, they're probably getting better, if that makes sense.
Yeah, it absolutely does.
And those things are very simple things, like trying to stay in shape. Exercise is, for me, like, I just feel so much better. And I feel pretty terrible if I haven't done it. Sleep is, you know, if I did not realize just how impatient and how like short I am without being well rested. And actually that's something I am happy to sort of say, no, I'm going to bed early tonight, or even have a nap. I would literally feel like reborn after I've had a nap. 20 minutes.
Mad, isn't it?
I feel better than when I woke up in the morning. So, and the other thing is that I turned 29 in February, and this year I've said I'm just not drinking, and that has given me so much clarity. Mm-hmm. It's sort of taken away the pressure. You know, that's another thing that society sort of bestows on you, that you can't be having fun if you're not drinking, or you should drink because it's someone's birthday. And it's like, well, and actually I just don't have to think about that anymore, and I can plan that I'm not going to feel like crap, and I am going to be able to go for a run the next day. And for me, that has been really very helpful. So, but I guess though, all of those things sort of then help with things like perfectionism and maybe not perfectionism, but especially the other two. Because often it was when I was hungover that I'd then avoid things, or then so I think it's a mixture, but definitely I can resonate. And I think your audience is, you know, if they're, I guess, anything like sort of, you know, the archetypal medical personality, or not even medical, but healthcare, you know, personality, I think a lot of people can resonate with those challenges. And
it's really important what you've said, and I've said before that I've kind of got a bit of I think it's a very basic triad that I think most people would understand, that the three main things that we need at the bottom of our sort of self-care triangle would be sleep, exercise, and nutrition, in that order. And those are the most important things. You've got to sort your sleep out first, then you've got to sort your exercise, and then your nutrition. And if you can do all three at the same time, great. And then the other things start being important, like you were saying, obviously, about the alcohol, therapy, journaling, socializing, all of these other things that are absolutely vital for our well-being and feeling good. And I think going back to what we were talking about at the start of our conversation when we were talking about burnout, I think part of burnout is that you're in survival mode for so long, and often those things aren't available to you. You know, good sleep isn't available to you, exercise probably isn't available to you, eating well, and maybe using alcohol as a coping mechanism. Those things are going to make the situation worse if you don't have access to them, and you're going through a traumatic time at work and not getting the rest that you need.
No, you're entirely right. You almost have this insult at work. You know, you're under major stress, you're seeing things or trying your best and not being able to sort out the problem, and then on top of that you have this attrition on, you know, those three things you talked about: your sleep, your nutrition, your ability to exercise. You know, when you're doing a night shift, you want to just eat crap. I don't know what it is. You just want to eat sugar. You want to eat crap, and it makes you feel worse. Your sleep's disrupted, and you don't exercise, and actually you feel completely, after 3 or 4 nights, you feel just so dreadful, and maybe it's no wonder. And then if you add on top of that, you're dealing with sick patients and you're stretched, and maybe you're working through a COVID pandemic, yeah.
Yeah, that small thing.
You're going to find it hard, aren't you? So that's a really good point, actually.
Yeah, and just something else I'd like to add about that. I don't know if you had, I remember we had this lecture in GEM, I don't know if you had it in undergrad, about Maslow's hierarchy of needs. I'm sorry to bring up this nerdy thing here.
Yeah.
At the bottom of, so Maslow's hierarchy of needs, I'm sure everyone's aware of it, but it's essentially like the needs that you have as a human, and the bottom tier is like your most basic physiological needs, and then as you go up to the top of it, it's like where you're thriving and reaching your full potential as a human. And the idea is that you have to fulfill those basic needs before you can move up and actually start to like love life and have great self-esteem, have a great, reach your potential, have a great experience. And at the bottom is like the most basic things. You need food, you need water, you need sleep, those kind of things. And then I think either the next tier up or the tier above that is safety. And when you feel like you're not accepted because you're worried about people judging you with perfectionism, or you're avoiding your work, or you're avoiding things that are important to you, and you're worried that you're going to be shamed for that, or that people are going to turf you out, or that you're going to somehow be found out if you've got imposter syndrome, and you're stressing about that. Inherently, your safety, your brain is telling you that your safety is in jeopardy, and you can't you're stuck in survival mode. And so when you're in this, and you're like in a traumatic scenario at work where you feel like, the buzzers and the layout of the ward and everything's really stressful and I don't feel safe, of course you're not going to have a good time. And yes, it's a recipe for disaster and burnout. But also, I think learning to overcome those feelings of avoidance and perfectionism and people pleasing and everything else we've talked about are so important, because you can't just take away one stimulus that's stressful, like the ward environment, and expect everything to get better. You have to deal with those things that are going on in your own head, and before you can move up those levels and get past the safety zone. I'm sorry if I think I'm like quite hungry. I haven't explained that very well.
No. And actually, I'm glad you sort of brought it up, because I definitely, to caveat that, I think those three things we talked about, the perfectionism, avoidance, and people pleasing, well, they're not going to go away. And it's about managing it and improving or getting better at saying no, or being more comfortable with letting someone down and taking a step back. But they're not going to go away. And I guess in my personal journey, like an example would be starting this YouTube channel. And that is something I mentioned before we started recording, that I've been thinking about for literally years. And I've been like following, I knew about Sarah's Etsy store and all these things through her channel. And, ultimately that is something that I have wanted to do for a while. And it's imposter syndrome that has, massively, and what other people think, that has massively stopped me from doing that. And almost you get these little wins. So then when I first did it, I was terrified. And actually, as soon as I burst that bubble, it was like, okay, I've achieved that. And it's not that all of it went away, but almost there was a chink in the armor, and then I could sort of tackle the next challenge. And I still have imposter syndrome. We were talking about it when we came on. It's like you peel back one layer and there's another layer to your imposter syndrome, which is another like challenge that you have to get through. But almost I'd peeled back the YouTube layer, and then I thought about messaging Sarah for about literally like 2-3 months before I ended up doing it. And then it was your comment that sort of on my YouTube video that sort of was like, oh, go on, like, and then we've managed to get this, and it's almost like another tick on the thing, and it's another sort of imposter syndrome layer gone. Because ultimately, like, I'm exactly the same person as I was like 6 months ago, and I'm just thinking, from someone watching this and looking in, I'm no different to any of you guys. I've just managed to break through a couple of those barriers. And I think if you look at the hierarchy of needs, talking about that, the very top is self-actualization. And there's a guy called Dan Beese, who has massively transformed my thinking around it. And he talks about entrepreneurialism and how we have to solve our problems and the entrepreneurial mindset beyond like a business thing, and talk about self-actualization. I highly recommend his stuff. But I definitely feel
I'd love to have a look at some of his content. That sounds really interesting.
Yeah, honestly. But almost, those problems don't go away. It's just that you get better at taking on the challenge. And I think it does get easier. It's like a muscle that you have to train, and then you get a bit of muscle memory, and each setback gets a bit easier. But I still massively, when we were starting this, it's like, oh my God, I'm not up to this. And now we've recorded for nearly an hour. So that's another I just really want to self-limited belief that I've managed to challenge, I guess. So yeah,
definitely. And I think you've hit the nail on the head there in that doing these things, it is just about like building up on habits. And like I've said throughout this conversation, my default is to go back to people pleasing and perfectionism and all these things and avoidance. And those are my like inbuilt coping mechanisms. But you can build habits and you can learn ways to stop doing that. And you get more confident in yourself when you're learning those techniques and habits. And it's just about putting yourself out there and doing these little things like we're doing today. What I actually more want to ask, if you have time, about your YouTube channel, as much as I'm interested in where it's going, and I think that's really exciting, I want to ask exactly like what made you want to do it, and what inspired you, and what you mentioned this channel that you watch about self-actualization, but like, are there any other channels that have inspired you?
Yeah, I mean, I've consumed YouTube content for a long time, and I think that definitely has been a factor in me creating a channel. I, over the last, especially like 3 or 4 years, have definitely, I feel like the first part of your 20s, you're sort of gathering information and consuming information to try and have a worldview. And almost now I want to discuss those things. And I was like, when the internet just cut out, I was thinking, oh God, I've actually really enjoyed this like long form but natural conversation and discovering, because some of these questions are fairly standard, but actually then you dig a bit deeper and the interests cross massively, and then you start discussing, things like the hierarchy of needs that and things like that, and realize that you're interested in those kind of things, and that's where like real ideas are shared and discussed. And so I think I have found that always quite an interesting idea. I don't know, to be honest, why I want to create a channel. I guess as I've like got further through my career and recognized the challenges that I've overcome, I felt more that I have something to share and like a story to tell. I appreciate that not everyone will want to hear it, but I guess the just sharing of a story, I think I'm now at a point in my life where I have learned lessons and made mistakes, and without being patronizing or, but that is just a feeling that I have to try and share some insight. But I also think I have been quite interested as a consumer of the technology, of the internet and of YouTube, and having witnessed people's lives change through, the essential spread of information. I've wanted to be part of that as well. And I think my interests have changed as well. Like, medicine's cool, and I really enjoy those human interactions that we talked about, and I really enjoy some of the pathology and the physiology, but almost that's always going to be there. And I feel like it's kind of taken away from other things that I'm interested in. And I guess this space is one that I'm fairly interested in, and I like the idea of getting to know someone whilst also them being a narrator of some kind of viewpoint, or a narrator on a topic, or and having multiple sources of information, so rather than relying on the scientist or the news, you can have multiple opinions, and actually and equally there's a artistic side to it, I guess, as well, that I enjoy. So I don't know where that all leads, and it's very interesting hearing your opinions on my channel, because you have a positive outlook on it, and actually, in my head, all I think about is, I should be uploading more, or I've
that doesn't go
gained any
away.
subscribers this week, or so it's so nice to actually hear some feedback like that. So thank you. Yeah,
I'm sure anyone that watches your channel would share the same sentiment.
Oh, thanks. But yeah, I don't know.
I'm not gaining followers thing. I mean, since I've come back to YouTube, the first few weeks, well, firstly, my engagement has tanked, and I think my video quality is pretty piss poor at the moment. Like, I don't know what I'm doing. I feel like I'm just
it's
a newbie
so hard,
again.
isn't it?
And I've actually been losing followers, which is kind of intentional in a way, because I want to, I want people to, the people that aren't here for the self-development content, that's fine.
100%.
They can go find the content that they're interested in, and I don't expect them to stick around for everything that I'm interested in. Yeah. But it's weird how, like, several years down the line, we're going through the same thing.
Yeah, no, and I don't anticipate that to get much easier, but I also like the idea of the sort of like working for yourself. It's always been something that I've been fairly interested in, and I mentioned that I set up this Amazon FBA business, and I learned so much about so much random stuff that just wasn't being covered at uni, and I just learned it all myself, and that was infinitely more satisfying than doing a load of past questions, or just sitting in a lecture and being told what to learn. Figuring it out for yourself is just one of the most satisfying, rewarding experiences. And it didn't come to anything, but it's solving your own problems, and and that's been really cool. So
what were you selling on Amazon?
They were like sort of like compression socks, like joint supports.
Oh, cool.
But that was a lesson to learn, is don't sell something that you don't fundamentally really believe in, because it doesn't make you feel great. So I didn't really massively rate my product, but yeah, I just sort of did that for a bit. It kind of funded my elective, and then as I went away, it kind of died down. But this is the other thing, is these things, they're like a fire. Like, you have to keep feeding them. Whether that's changing your SEO sort of like keywords, or staying on top of your social media or your posts, and so I think it's trying to figure out a way of having that, because I didn't care about these socks, but actually I do care about medicine. I do care about like men's mental health. I do care about a load of topics that I hope to discuss on my channel, and then it almost doesn't feel like work. Like, this conversation has just been so easy, and
it doesn't feel like work,
and enjoyable, and actually I think it's trying to figure out that, and then almost then you have all the content, and it's just the systems or the admin to get it out and package it up, and ultimately try and provide value.
I was just going to touch upon something you mentioned there very briefly, about how with YouTube and creating an online presence, you can feel like you're not doing enough, and you're like, oh, I've released one video, and like, okay, now the next, and like, you've got to keep that cycle moving. And you posted on Instagram one day, and then you're like, well, that's one day done, I've still got to post tomorrow, and it can feel like this constant never enoughness. And medicine feels like that as well. I don't know if
it's like patience, isn't it?
You see one, and there's like a queue waiting for you, and You have
All right,
to
so you've
kind
been
of get,
discharged, and then there's still 8 to see. You're
Yeah,
like, oh,
exactly.
I'll pick up the next one.
And by the way, don't forget about your jobs list. And there's
Yeah.
this angry relative that wants. So yeah, you kind of have to get used to that like feeling of never quite doing enough.
Yeah, no, I imagine so.
Yeah, I think, you know, it sounds like you probably already are at that point if you've mastered it with medicine. But
No,
also
I mean, it just resonates. And then, and I think, so I heard Gary Vee talk about this like years ago, but he was talking about like the macro and the micro, and how we get stuck and can't figure out, you know, the difference. So you have like these sort of entrepreneurs who think about where they're going to end up and like the whole business idea, but actually then can't put together the building blocks, the little micro jobs, and tick those off that get them to the bigger picture. And that humans like just get stuck in that. And I think the other sort of expression is that you overestimate what you can achieve in a year and underestimate what you can achieve in 10. And
love that.
Like, those are things that I, you know, exactly what you just said. You upload a video, it's taking you like 8 hours to record and upload, and then like, I don't know, 32 people watch it in the first 4 hours, and you're like, what am I doing? But at that point you need to just like turn your phone off and be like, I'm actually I'm getting to a place where I want to be, and it's like trusting the process. And it's hard, and especially coming from, as much as medicine, like you get used to that. Medicine, you have sort of like, well, you go home at this time and you get paid this much, and there's this guarantee. So it's a different mindset, I guess, and that has a like pro and con, and I think it attracts a certain type of person more than another. But it's been really fascinating from a like psychology point of view, just and recognize my own thoughts around it, because some days I come home, I'm like, oh, I have achieved nothing, and other days I'm like, I'm going to be the next Mr. Beast, you know, like so optimistic. And it's just,
I feel the same. Yeah, it's actually, I think I can't remember the exact numbers, but I'll dig them out and send them to you. But Ali Abdaal shared something really interesting about the average number of videos it takes to get to 1,000 subscribers, and then like the average number of videos it takes to get to 10,000 and 100,000. And I feel like as I said, I've been like doing YouTube for so many years and putting out all these videos, and somehow I'm actually statistically above the norm in terms of like how many videos I've put out versus how many subscribers I've got, which is absolutely shocking to me, because I've put out so many videos and like relatively don't actually have a lot of subscribers. But it's encouraging to know, just to keep plugging on.
No, that is because you've made out that it's, you know, been, you know, just from what you've made out, I wasn't expecting you to say that you were, you know, just from the impression you've given off of how much you've uploaded and how long you've been on the platform. And that is fascinating. There's a guy called Chris Williamson, and I don't know if you've heard of him. He's quite into like
all these people down.
Evolutionary psychology. He's got this podcast called something mindset, modern wisdom, I think. And he talks about like the statistics of podcasts. And he said that I think it's something like 50% of podcasts only ever have 3 episodes. So if you make 4 episodes of a podcast, you're in the top 50%. And then even worse, the next number is 99%, and that is 20 podcasts. So if you made 21 episodes of podcasts, you're in the top 1% of podcasts, just statistically. So it's almost like, you know, so everyone is having these thoughts of imposter syndrome, self-limiting beliefs. Everyone is. And almost as much as that is a challenge to overcome, once you manage to overcome it, you can then be reassured that actually everyone you're competing with, not that it's necessarily a competition, but, you know, they are also struggling with this. And so if you can break free to a degree from those like shackles as such from your own like human psychology, then you have a massive advantage. And I've just found that fascinating that if you have 21 episodes of a podcast, you're in the top 1%. Like,
that is absolutely mind-blowing.
60 hours of work.
Really
it's like
that.
Yeah, incredible.
And
so
I mean, it goes to show, doesn't it, that what you were talking about earlier about just taking action and just keeping going with things, that's going to put you ahead. And, you know, like you said, it's not a competition, but it statistically is going to put you ahead of other people.
Yeah,
because you're doing what not a lot of other people would do. I don't know. So I've had strange reactions at work with people with me doing social media, in that most people are like, I don't understand it. Who is watching these kind of videos? Like, I just don't get it. But then again, they're not necessarily my target audience. And then I've also had medical students, or, you know, more junior doctors saying like, oh, I've seen a couple of your videos, and like, oh, it's nice to meet you, and that kind of thing. And that's always like, I always feel a bit nervous about that kind of thing. But then I also have the majority of the people that I've spoken to about it at work are just like in the first camp, where they're just like, I don't get it. I don't know why you're doing this. Yeah. Not in a horrible way, but like, we feel like we're in a crowded market on YouTube, and we look at other YouTubers and people that we aspire to emulate, but actually we're in a really, really, really tiny minority of people who are willing to get our cameras out and share our thoughts openly online and actually upload several times in a row.
And have the discipline to maintain it, you know.
Absolutely. Yeah. And overcome that fear of like, oh my God, I look like an absolute idiot, but I'm just going to press upload anyway. There's an Andy Warhol quote that I always come back to that is something like, while I'm creating art, I let everyone else worry about what they think about the art. And while they're worrying about that, I create the next piece of art. And I just keep thinking about that when I'm uploading my YouTube videos. When I get to that 4-hour mark and I've only got 32 views, I'm like, it doesn't matter, because I'm on to the next one now.
Yeah. No, and I think that's another thing, is that, you know, we've kind of skirted around it as a topic, but I guess it's comparison. And we do it naturally, but it can be sometimes to our detriment and can limit, actual action taking. And I think the other thing is that, you know, in the internet, as much as it's allowed people to share information freely, it also, with things like subscribers and suggested algorithms, and it also pockets you into a certain type of person and a certain type of audience. And naturally, as a consumer of the internet, then you also will, for me, you know, watch people that are like Chris Williamson, and so then I end up comparing myself to these people that, you know, who are entrepreneurs or who are into fitness, and then it makes me feel worse about myself. But actually, that's just one tiny pocket of the internet of people that are interested in that topic. And I guess you have to try and be aware of that. And there's another sort of thing to touch on, which is the idea that you're the sum of the 5 people you spend the most time with. And some people are saying that actually that's now the 5 people that you consume the most on the internet. And so
I love that.
Yeah. So if you're then putting yourself into a self-development space, or a positive mindset space, or a growth or entrepreneurial space, and you're consuming that content, then that is naturally going to push you in a certain direction or have a certain effect on your psyche. Whereas if you're, you know, not, or not that I have anything against gamers, but, you know, if you're doing that, then it's going to, or another less sort of like positive, or, you know, it's the same with like media. You have like right-wing media, and that's how these political ideologies become more, you know, exaggerated and more extreme, and you know, any type of political on the political spectrum. And so I guess you have to recognize that you're comparing yourself to people within that niche, but also depending on which niche you choose to associate yourself with may influence where you end up going and how you end up seeing the world. And
Yeah.
So as much as it's hard to compare yourself to these entrepreneurs or very fit people, or equally you're putting yourself in a position where you're being influenced by people that have been successful. So maybe those two things balance themselves out. I don't know if I've articulated that as well as it is in my head, but
definitely, I think there's something to be said between about the fine balance between like being inspired versus comparing yourself negatively. We could do a very much a deep dive into that. I've got a lot of thoughts on that. I think it's really valuable what you're saying about the 5 people that you surround yourself with, and that, you know, that doesn't have to be people in real life. If you don't, and I think it's important for viewers to remember as well that, you know, you may be in a position where you might feel a bit lonely in your real life. You don't have a lot of people around you who are interested in the same sorts of things as you, and that can feel really hard. But we have access to the internet, and you have access to podcasts and books and YouTube channels, and you can put yourself in the room, so to speak, with these people that you aspire to be like.
I think I'm just going to come back to one of my previous questions that you asked about.
Oh, did it come back to you?
Of YouTube. Well, kind of in that answer was, you know, the internet is, I think, the great leveler of sort of our generation. So I spent sort of my mid-20s being like upset and angry and sort of vexed by the house prices and the, you know, the junior doctor pay and all these things that are, you know, not great, but actually were out of my control. And almost, we do have a generation that has, you know, high student debt compared to previous generations, or you know, much higher housing prices compared to the average salary as a multiple, and that is a challenge. But what we also have is a massive leveler in the internet, and I felt like that was the sort of balance on that scale as such, and almost that medicine, a career in medicine, is a good deal, but it was a much better deal 20 years ago, and even better deal 30 years ago. And almost the scales has been getting worse and worse as a deal. And the thing that is not in medicine that kind of balances that, and it's not just financial, but it's more like a quality of life. It is the internet. You know, you can work location independent now. Like, you couldn't do that. That's huge for quality of life. Or and actually, I didn't get any benefits from working from home. Not that I want to do that all the time, but it's an option. And so I definitely, the technology of the internet has massively, my understanding of it and the power and freedom that it provides, I think I've understood to a greater extent as I've sort of got a bit older. So
yeah, we're so lucky, aren't we? You know, and like you said, you know, we can spend our time moaning, and I've definitely been in this position where I've just been in this like complaining mindset where I've been like, you know, life's not fair. I'm in this amount of student debt. You know, I'm earning this, or whatever other life circumstances that feel like I'm a victim, and we can kind of play into this negativity in our own heads and put ourselves in a victim mindset. Or we can say, oh my gosh, I have access to so many resources online that people in previous generations didn't have access to. There is, you know, anything we want to know about or learn about is at our fingertips. It's just up to us to take a bit of self-responsibility to take action on those things. And the impetus, you know, the onus is on us to have that drive to do it. And I think that is really exciting.
Yeah, definitely.
But it also feels like a lot of pressure sometimes.
Oh, 100%.
Have you ever thought about starting a podcast?
I have, and actually it's kind of viewing this as a bit of a maybe like pilot. I have definitely thought about it, and I think the thing that's putting me off is I've been having to say I'm starting a podcast, which seems to be like, you know, sort of like the Avo toast of, you know, 2022 exactly or 2023. Like, and I don't necessarily want to be that bloke, but
you've done it with the YouTube channel.
Well, exactly. Yeah. So I might as well just like, that's what most YouTubers do, isn't it? They start on YouTube and then have a podcast. So maybe I have a claim to a podcast that I should take. But I think something to think about for sure. So
it's been rolling around in my head a lot recently, and I keep thinking like, oh, maybe I should. But then the thing that's holding me back from it, and I think it's probably just me putting excuses in my way, is like, do I want to add another thing to my plate? But then equally, I love to consume podcasts, and I think that you build a stronger bond with the person that is the podcaster than you would with a YouTuber or someone you follow on Instagram, because once I don't know about you, but once I start listening to a podcast, I don't tend to skip away from it. I'll listen to it while I'm working out or while I'm on a walk or while I'm doing chores or whatever.
No, it's on and it's like
and in your head, and you're really listening to what they're saying. Whereas on a YouTube video or whatever, you might just only be paying half attention or skip past it if it gets
100%.
boring. So I think that it's a really great way to consume media, and been thinking about it quite a lot recently. But the other thing that's holding me back from it is I have a tendency to, as you probably can tell from this conversation, to have a bit of shiny object syndrome and like jump from thing to thing and like get excited about different projects and not necessarily see things through to fruition or completion. And I feel like I really want to hone my system for producing YouTube at the same time as marketing this course and putting out regular Instagram content. And once my thought is that once I've got that system down, maybe in a month or 2, 3, and I'm feeling confident about like not getting overwhelmed and being able to keep churning that out on a regular basis, then maybe I'll start. Or maybe I could just repurpose content and like record YouTube videos and put them out as podcasts. I don't know.
So I'm gonna be devil's advocate here, Sarah, and what you just said was maybe in a couple of months' time, once I've done this, I will then do it. And I think your concern of overwhelm is obviously a valid concern that I would share, but would that be a slight avoidance? Will you ever feel confident enough? No, will you ever feel confident enough with your YouTube to then start the podcast?
That's a great point. That's a great point.
Maybe you should just start now.
Yeah, maybe I should just start now. Interesting.
Maybe this can be the pilot for both of our podcasts.
Maybe it is. I mean, it's been an awesome conversation. I feel like we could just keep riffing and I mean, if either of us do go ahead and do a podcast, then be very happy to collaborate on that in some sense.
Absolutely. Thanks so much. Any further topics you wanted to brainstorm or?
Yes.
Yep. Perfect.
Any book recommendations? It's interesting to talk with a medic who's interested in like all the things that you've talked about today: entrepreneurship, mental health. We've talked a lot about personal development, those kind of things. And I wonder if you have any good book recommendations for myself and people watching.
Yes. So I'm not much of a reader. So that's probably partly why I consume so much YouTube. But one book that I've read on my elective, and actually I've got a few book recommendations. These are actually all of my books that I've ever read. So maybe they're just like the only books I've read. They're not actually good books. I just haven't read enough to know. But, the first one is Man's Search for Meaning by Viktor Frankl. I don't know if you've heard of that.
I have. I've got it on my Audible, but I haven't actually listened to it yet. Yeah.
So for the audience, this is a book by a Austrian neuropsychiatrist who was in a concentration camp, I believe in Auschwitz, and he observed people that didn't, fare so well and people that did fare so well during his time in Auschwitz. And essentially he talks about the need to find meaning in whatever it is in your life. And I thought straight away when you were talking about your course and the lack of purpose people have in their lives, about him. He went on to develop something called logotherapy, which is, I don't think, a very used, I may be wrong, therapy now, but he went on after his time in Auschwitz and surviving it to then practice this and sort of instigate that in people's lives, and I think with some degree of success. But he talks about how he found meaning in his suffering, and actually it's a horribly ghastly sort of account of what went on, but it talks about how you deal with that, and it's a book that I definitely sort of still draw upon. And I guess the other book, or it's not as much a book, is Meditations by Marcus Aurelius. Stoicism has kind of had a bit of a, I think, resurgence, which is probably why I've heard a bit, but it's something that I just sort of pick up and delve into. And these are the journals entries of Marcus Aurelius, who was one of the sort of emperors of Rome, but also a philosopher, part of the Stoics. And similarly, there's this sort of shared, I guess, in these two books, there's this shared sort of, I guess, need for adversity or understanding of life through some previous adversity. So Seneca, who was one of the Stoics before Marcus Aurelius, who taught him, he was a slave for 30 years, and he then sort of was a free man, and in his time as a free man sort of developed, was one of the founding people in Stoicism. I don't know loads about it, but that, I guess, is just an interesting sort of mirror. And it talks about sort of things like mortality and how, and just how you deal with that. It's a difficult topic, but actually it gives you a scope to view your life and the meaning in your life. And I find that useful as well. So those are my two books that I would recommend. The second is a bit more random, a bit more of a pick it up, read it on the tube, read a line and think about that. And the first is more a typical book, but both things that I've found very useful.
It's really interesting that you said about them both having that common thread of need for adversity, and then moving on from that and kind of developing a bit of a life philosophy from that, because I think that links back to what we've talked about in this conversation, and what we've been through, especially what you've opened up to a bit more about burnout, drinking, gambling,
No, absolutely.
And what I've mentioned about failure and those kind of things. And there's lots more on that topic that I could talk about. But I think it's very poignant that those are the two books that you've chosen, because
probably
it's really important. And I think that hopefully people watching this video will pick those kind of books up and realize that if you're going through a tough time, there are better days ahead. The best days of our lives are always ahead of us, and there's meaning to be found in difficult times.
A lot of learning, a lot of growth, and I resonate with it fully. I do think that's quite interesting that those are the books that I chose to talk about in a weird way, but yeah.
Well, if they're the only two books you've ever read.
Well, exactly, yeah. It was Biff and Chip before that.
Biff and Chip.
Biff and Chip, Holes, and then straight onto that. No.
Next time we talk, let's have a deeper, meaningful conversation about the impact of Biff and Chip on your future.
Let's book it in. First real episode of the podcast.
Oh, fantastic. Well, Dan, it's been an absolute pleasure. Thank you so much for having me come and chat with you. I hope we're going to get a lot of pieces of content out of this.
Yeah, hopefully. Likewise. And thanks. It's like I said, I've really enjoyed it, to be honest. And actually, you can hold yourself as one of the layers of imposter syndrome that has come off of my personal YouTube journey.
Oh,
So
thank you.
I
I
will
feel so
forever
honoured.
be grateful for that.
I'm a
But yeah,
layer
really
of an
enjoyed it.
onion.
Oh, exactly.
No, I
But
really appreciate you saying that. It does feel like a privilege, so thank you.
no, thank you. But where can people find you? You mentioned you're on Instagram as well as YouTube.
Yeah. Instagram and I'm on YouTube. Both of those are Dr. Sarah Nichols, Dr. spelled DR. And if you would like to know more about what I'm up to, my course, then under my most recent videos, there will be a link to that.
Great. And whatever we will chop this up into, or the long form video, the link will be down in the description as well if it's on my channel. So yeah, Sarah, thank you so much. And
thank you, Dan.
Yeah,
and for my followers, Dan, where can people find more about you?
So I'm actually on TikTok as well as YouTube. So the TikTok stuff is kind of, I don't know, it's just a bit more medical education and a bit more random stuff. And then the YouTube's a bit more long form and sort of talk about medicine, the period I've had recently of leaving medicine. And I think I'm probably going to end up getting into a bit more preventative medicine and health and fitness. So those are things to expect in the future, but I'm always down for a DMC. So if you're interested in that, then come and have a look on the channel and we'll see you there.
Very cool. Thanks, Dan.
Great. Sarah, thanks very much. I'm going to end the recording.
Awesome.